20th ACNN webinar. Today webinar is a bit special. We have speakers from Singapore, from Tanzania, from Japan to share their knowledge on speakers' perspective after they have attended the nursing conference in Hue City, Vietnam, and in Chennai, India. So our three speakers from Singapore will be Dr. Keow, Miss Tan Ling, Miss Chai Ling. Sorry, I didn't see you. Hello. And Miss Mai from Japan and Miss Dorcas from Tanzania. Our moderators for today will be myself and Christine. Our commentators will be Professor Yiguai and Miss Bantane from Vietnam. So I would like to call upon Professor Yoko Kato to give a few words before we start the webinar. Prof, please.
Okay, hi, everyone, hi. So you look very nice. Thank you very much for joining the ACNN webinar, and thank you very much for support this webinar every time. Of course, we need their knowledge and the power for the treatment of patients. So this is very special, how to say, topics. So we are very much looking forward. There's 3 Singapore and 1 Japan and 1 from Tanzania. So let's start. Thank you very much. Raja, thank you very much for every time.
Arigato, Sensei.
Thank you, Prof.
Thank you, Prof.
Okay, Prof. Yiguai is already here. Okay, I shall introduce
Hi,
the
guys.
first speaker,
Hi, Professor Kato.
Dr. Keow. She's a senior nurse clinician attached to the nursing department and the neurosurgical department in NNI Singapore. So she oversees nursing quality, patient safety, nursing research quality, and patient safety as well in the neurosurgical department. And she leads the nursing team in the write-up of nurses' sample signature, registration of medication, storage of medication, vaccines, started the Google Drive as platform for research knowledge. So she has a vast responsibility, and she involves in set up a lot of database for aneurysm, ABM, brain bypass, head injury, intracerebral hemorrhage, and she also has numerous publications, and she has also achieved a lot of awards in her institution. So with her will be Miss Tan Ling. Miss Tan Ling will pair with Dr. Keow. Miss Tan Ling is assistant nurse clinician at once practice nurse neuroscience nursing in NNI Singapore, and she is a senior education associate with Sing Health, Duke NUH Neuroscience Academic Clinician Program. So she's doing her still doing her study. She will be like Dr. Lee one day, and she also have a lot of publication, and her clinical outcomes of ventricular peritoneal shunting in patients with classic versus complex NPH normal pressure hydrocephalus. This is her main publication, and she also facilitates effectively workplace learning and healthcare professionals. So without further ado, may I invite both Dr. Lee and Ms. Tan to present your perspective, please.
Thank you for the kind introduction. Let me share my slides first. Yeah.
You can share your slide.
Can you see my slides? Okay. Can anyone see my slides?
Can you make it full screen,
Yeah,
please?
we can.
Yeah, it's a full screen.
Okay.
Okay.
Yes, yes.
Okay, so good afternoon, everyone. Good evening. Thank you for the introduction. We'd like to take an opportunity to thank the organizer and committee for the invitation for us to share our nursing perspective after attending the Congress in Vietnam. So it will be shared between by myself and Dr. Lee. So before we start, we'd like to congrats the success of this Congress, and we'd like to thank the organizing committee for the invitations and sponsorship, and the warm hospitality that we had with the nursing colleagues in Vietnam, which is from Hanoi and Hue. So we go to the topic that what we observed from the conference is that it was well-covered lecture topics where there was a broad neurosurgical and nursing team was being covered with an impressive attendance from the local nurses support, excellent organization where they have a very smooth registration process, supportive exhibition booth by the vendors, and the venue for the conference was very conducive. So we are very blessed that we managed to visit 2 local hospitals during our visit to Vietnam, which includes 2 hospitals, which the VetU University of Hospital in Hanoi and Hue Central Hospital, where we managed to visit them, and thank you for the accommodating us for our ad hoc request that we have some interaction with the local nurses in the hospital. And what did we observe during the hospital stays? We do notice different hospital has there's slight difference with their hospital setups in terms of technology use and equipment use, but we are impressed with the local nurses' innovations because to make their works more effective and more efficiently, hospital infrastructure-wise is slightly different, where we do notice that the NICU in Vietnam is a open space concept, meaning that 8 to 10 patients was shared in a bigger room, whereas in our local context, the NICUs is using individual patients' room, and the nurse ratio for our local context is 1 nurse is to 2 patients in NICU. So what are the challenges that we encounter, as many due to the language barrier that we have with the local nurses, but despite that the conference is being conducted mainly in Vietnamese, we have to accommodate with the local nurses' needs, but we are fortunate to have Ms. Hannah to help us to translate our slide from English to Vietnamese for the local nurses' needs, and also with the AI technology that we have, it doesn't stop us from interacting and communicating with the local nurses there. And what we had was we started our network in Vietnam since the first day we landed in Vietnam and we met with the nurses and the surgeons from Vietnam and even the speakers from Japan and Malaysia. And the network was continued not only just in Vietnam, it was also being extended to Singapore, where we have the honor to invite Matron Eat to attend our NNI nursing seminar in August, where we are able to promote ACNN nursing to our local nurses also. Yeah, so next I will be sharing, I'll pass to Sister Keow to share more on how do we wish to share on the networking and collaboration in future. Yeah, just a minute, Keow will continue her slide. I'll stop sharing. use my slides. Sorry, due to the technical.
Can you
Just hold on
unmute
first.
yourself, Dr. Lika Keow?
Yeah, she'll use mine. Just hold on.
Oh, okay.
Okay, sorry for the technical error. Yeah, thanks. So as what Billing has shared, all right, our networking started already when we're in Vietnam. We believe that we can continue this networking and collaboration efforts. Okay, so for conferences that are targeting at local participants, we're just thinking that if the center is keen, actually we could maximize the speaker knowledge and expertise, such as having some small roundtable presentation, discussion on topic, that in a way we can actually exchange our practices and also can actually address some of the language barrier. All right, we do notice that ACNS and ACN already have a very well-established network and platform. All right, so we should continue to leverage on these resources to share, our knowledge. All right, and also and in NII itself, we are National Neuroscience Institute. We do have a group of nurses who are specialized in particular programs. We would also like to actually contribute if there's opportunity arrived. Right. At the same time, like to also share NNI is actually part of SingHealth. SingHealth is actually one of the largest public healthcare institutions. A few years ago already, we have set up the Global Health Unit. And last year, we also started the Center for Global Nursing. They also have some collaborating center in Sri Lanka, Jaffna, Hanoi, Vietnam, as well as Medan in Indonesia. So the doctors, nurses, and allied health professionals that are involved in some of the project, they're actually given official appointments whereby they are given official time to actually engage with the center that are of interest to collaborate with us. Right. So giving an example is that this is one of the project that we have in NI itself, that we went to Jaffna, Sri Lanka, whereby our surgeon, our neurosurgeon, Dr. Jai Rao, our director of nursing, and also one of our advanced practitioners actually went for a site visit in Jaffna to look at what are the needs of the center. And following that visit, we actually work offline to see what are the topic that the nurses require. And we actually work with them to establish structured curriculum. Actually, a total about 12 topic was actually a workout. All right, and we continue that relationship offline, and also the nurses actually fly over to Jaffna. At the same time, we empower the nurses to do some train the trainers. So that in that way, actually it benefited both, right? Because we also learn a lot on some of the things that they have. So other things that, because we believe that every country, even in the same country, different center do have different conditions and also needs. So we do need to cater to the specific center, right? We also work with China at the moment, Huasi on their advanced practitioners capability. So these are some of the things that we are working at the moment. So we are looking at for opportunity to collaborate with more center around the world. Thanks.
Okay, thank you both Dr. Lika Keow and Ms. Tan Ling. I shall call upon our next speaker, Ms. Chai Wan Ling. She is a senior staff nurse attached to Surgical Clinical Nursing Unit, National University Hospital Singapore. She's a mentor to junior nurses and students. And she also received numerous awards and involved in multiple QI projects. So may I call upon Ms. Chai Wan Ling?
Thank you, Machani. Thank you for the invitation. Let me share my slides now.
Is there any problem?
Are you able to share your screen running?
There is a
Or you want
green button on the Zoom. Just click on share. Then choose the presentation. Close all the windows. Just keep the presentation. Then click share. Did you see the share button?
Is this that my laptop didn't allow? One moment, please.
you want me to share from my side?
Yeah, I can also mention it if possible.
Okay. I share from here.
Thank
So
I think I'm able to already have y'all. Can y'all see?
betul. Okay.
The laptop issue. Okay. Thank you everyone for waiting. Sorry for the technical issue. Thanks for the invitation again. The presentation slides is prepared in terms of giving some feedback and in terms of as a speaker during in Hanoi, in Hue as a speaker to have some collaboration lah. Some introduction of my role. I was a speaker in the 2025 Vietnamese Neurosurgery Conference, and my topic was optimizing neurosurgical nursing care, evidence-based and nurse-led strategy. And the aim of this presentation here is to share some reflection and feedback. We focus on the positive experience that we had, challenges that we faced, and some suggestion for improvement for the future conference. And the goal here is to support continuous improvement for future conference. The positive experience that me and my colleague have is overall the conference was well organized. The registration and pre-event communication was smooth. The session was also insightful because we covering relevant topics that can be applied to nursing practice. I also appreciate the diversity of speakers, both local and international, because it gave us different perspective on nursing challenges and innovation in every country. Another highlight for me was the opportunity to network with nurses from across the region, exchanging ideas and experience, and most importantly, make some friends from the conference. And finally, the hospitality in Vietnam was warm and welcoming, which made the conference experience truly memorable. Some challenges and area for improvement, like any other big event, they will always have some challenges. Firstly, actually there was no time for Q&A, and some presentation was a bit too rushed due to the time constraint, leaving no room for question on the day itself, and there was no discussion was held. And this discussion is actually important as it would allow a deeper engagement and knowledge exchange between speakers and also between the speakers and the participants. And I felt that some long sessions could have benefits from more breaks in between, because I still remember during the last speaker for the morning session, most of the audience are actually left for the lunch break before the presentation end. And I received feedback from one of the audience. There were also some language barrier, like what Ling has mentioned earlier, which made it a bit harder to follow certain presentation. And finally, as an international speaker, I felt that if they could have more structured on-site support in terms of while the organizer and staff are actually very welcoming, at times it was challenging to navigate the venue and locate the session hall and access to important information quickly. So a dedicated help desk or assign some volunteers for the international participant would have made the experience smoother, especially for those unfamiliar with the local language and logistics. The additional support would not only help the international speaker to feel more at ease, but to allow the speaker to focus fully on contributing to the conference. So some suggestion for future conference will be the longer Q&A, breakout session, and the volunteers. And some personal reflection, these are our photo on the day itself from all the international speaker and the local speaker in the morning session. Personally, I found this conference is very enriching, and it reminds me of the importance of continuous learning and international collaboration in nursing. As a speaker, it was an honor to contribute and also to learn from the experiences from others. The knowledge and connection that I gain will definitely influence my own practice and my teaching. So in conclusion, I would like to thank the organizer for putting together such a meaningful conference. Despite some of the challenges, the strength actually far outweighed them. The event created an excellent platform to exchange knowledge and strengthen collaboration in the nursing across border. So I'm actually looking forward to future conferences and continue opportunity to grow together as a nursing community. Thank you.
Thank you, Ms. Wan Ling. Shall I call upon the commentators now, Prof. Yigui and Ms. Ngo, to give your suggestions, maybe some comments to the three speakers?
Okay, thank you, Meeting Yi, and good evening, Professor Kato, and all the participants. And it's my honor to be one of these attender to this webinar. And I'm glad to see all the sisters to share their insights and perspective to attend the conference in Vietnam. Last year, I went to Hanoi to attend the meeting, and had the personal feeling with is the similar personal feeling with these nurses, and to feel the warm hospitality of our Vietnamese colleagues, and to the different culture exposure. And I think I agree. I think the Miss Lee from Singapore mentioned that the hybrid training, including virtual and face-to-face in field training, and the trainers are very important. So after the pandemic, the virtual webinar and the conference is popular. I think this is a good tool for the peoples in different countries to communicate. But I also think the field conference face-to-face is more important than the virtual conference, because in the online, the virtual communicating, after the meeting, we are also the strangers. We seldom contact later. But in the conference, just as these sisters mentioned, we feel the different culture and the hospitality of the local organizer, and make friends, and then we invited each others in the future. We can share the different experiences and making friends, and I think this is also very important. In China, just as the sisters mentioned, that the language barrier is also a big problem. My personal experience, my colleagues, the nurses, we are good friends, and but they are very shy, and because in China our English is not good. I send emails to Professor Kato before, was when I attend these virtual meetings, the language is making me very nervous because sometimes I hardly to understand the others said. So I cannot ask the questions to give comments. And after my speech, the other colleagues asked me questions. Um, it is embarrassing to hardly understand the others' questions. So I thought my colleagues, the nurses, sisters, they are eager to attend such meetings, but they are very shy to express themselves. And um, but, but now some the technology can help us because such as the real-time translator, or I saw some virtual reality the glasses now. Maybe in the near future we can use those tools to enhancing our communication. Yeah, that's all. Thank you.
Thank you, Prof. Yigwe. Ms. Ngong, anything to add?
Good evening, Professor Kato and Professor Yuko and everyone. So I'm from Vietnam. So I also joined the conference in Hue in Vietnam in June, right? And I also meet several of you guys in there. So I do believe and agree with. First of all, thank you so much for inviting me as the commentators and I can give some my comments. And thank you the speaker who participate in the conference in Vietnam. Thank you so much for your positive experience. And as you also mentioned in your presentation, I also agree with Miss Tan Ling and also Miss Chai Won Ling that we have like language barriers. So sometimes we have like problem with communication, and I also agree with Miss Chai Wen Ling that we have no time for Q&A discussion because for the nurses, we only have one hall for the whole conference. And in one hall, we have many session, and each session we have a lot of presentation. So that's why we only have like around 5 to 10 minutes for presentation, and the Q&A we have not enough time for discuss. But I believe that the discussion is one of the most important part for us to share about our experience, our question. We want to know more about the speaker presentation, but because of limited time and also resource, so we don't have enough time. So I think that maybe as I can give that my suggestion that maybe we should have more like a whole, and the section we have the specialty for each specialty. For example, I'm an ICU nurse, so I would choose like section especially for nurses for the ICU nurse. And if I the medical nurse, so I will follow the track for the medical section, something like that. So it will have like we have more session, so we will have like more time for presentation and also discussion part. That is the first suggestion. And the second thing, because right now I'm studying PhD, and I from my observation from the all of the speakers, I see that most of the presentation they're sharing about the clinical experience, but not much of the presentation mentioned about like scientific research. And even we have some, but it's not rigorous in the methodology. So my suggestion maybe we can have like next several seminar. Maybe we can share about like how to guide the nurse to do the research in the like the basic. First is the basic information, and so from that we can have like more collaboration for the research. That is my suggestions. Thank you.
Thank you, Mr. Prof. Anyaku. Do you have anything to add about nursing conference? How about your country? You are unmute, Prof. Can you unmute, please? You're muted.
Yeah, so yeah, thank you so much, man. Thank you. It's interesting being in this webinar. Yeah, my name is Ikechukwu Aniako. I'm a Nigerian, a young neurosurgeon, but I'm currently on a posting, a volunteer posting in Zanzibar, Nazi Moja Hospital, Zanzibar. So neurosurgery is still evolving in my country. And most of our nurses actually are not really specialist neuro nurses. So they train or in the field, they train in the wards. So we've not had the opportunity of sending our nurses for formal training in neuro nursing. So we are still evolving. So thank you so much. It's interesting seeing what neuro nurses are doing all over the world. And I will take the story back so that we can join the world of neuro nurses. Thank you so much. Yes.
Thank you, Prof.
Okay.
Prof. Kato, do you have any comment?
Yeah, thank you so much. I think, of course, the nursing task is very, very important for doctors and the patient also. And I think not only the practice, but also knowledge, accepted knowledge of the neurosurgery is quite important. So maybe you can, because we have 3 nurse practitioners in our department, they work so hard. Of course, they know the high knowledge. Then they join the old endovascular or open surgery day by day, I think. So the practice is very important, I think, just besides the doctors. Thank you very much. It's a nice the trial.
Thank you for all the suggestions and comments, and the 3 speakers. You have given us a very good presentation. I think we will continue the collaboration, even though nurses from other parts of the country, maybe other parts, they may not speak English well, but then they have no knowledge. I think the collaboration need to be continued, and to I think neurosurgical nurses are very, very lucky. We have the support from Professor Yoko Kato, and the rest of the neurosurgeons are always very supportive. That is why our ACNN, we are moving forward, even though we are slow, but we are still on the move. So I hope we will continue to move and be in par with those in the Western countries. So with that, I think I shall pass the floor to Christine. Can you please introduce the next speakers, please? Thank you.
Thank you, Ma'am Yi. Thank you for our distinguished speaker, Professor Kato. Thank you, and Professor Yugo and Professor Aniaku. And let us now we can listen to the distinguished our speaker in session 2. Now, I want to invite Ms. Dorcas Gideon Magawa, who will present on neurosurgical nursing in Tanzania, and Ms. May Okubo, who will be sharing her insight and perspective on financing and collaboration. And Ma'am Yi, she is sharing about the about the brief report, the Vietnam Neurological Nursing Congress, Vietnam. And we will invite for the commentator, Professor Ibu and Miss Ngok. And for the first, and we will invite Miss May Okubo, please. Yeah, okay. Yeah, time is yours. Thank you.
Thank you. Can you see this right? Okay.
Yes, yes.
Okay, thank you for introduction. Asian Congress of Neuronursing. It's my introduction. I'm a nurse practitioner in Japan. This slide shows an overview of the conference. The ACNN is an international conference in Asia, and the goal is to advance neuronursing. The conference took place on June 13th and 14th, 2025 in Chennai, India. The main goal was to share knowledge, improve skills, and increase expertise. It was a great place for many different professionals and generations to exchange ideas. The main contents include keynote lectures, panel discussion, and workshops. The pie chart here shows the participants. Most of them were nurses. And I felt the theme was advancing neuronursing, innovation, leadership, and sustainable care. Before I talk about the conference, I want to give you some basic information about India. The population is very large, about 1.4 billion people, which is the largest in the world. The official language is Hindi, but there are 21 other state languages. Now let's look at the medical system in India. There are two main types of healthcare, public and private. Public hospitals have low fees and are mostly in rural areas, while private hospitals are in urban and rural areas. There's also a shortage of doctors and nurses, and they are not distributed evenly. Another problem is that patients have to pay about 60% of their medical costs themselves. This slide is about nursing in India. To become a nurse, people can go to nursing school for GNM degree or nursing university for BSc in nursing. Many courses are in English. For advanced education, there's the MSc in nursing for 2 years, and also a PhD in nursing to train researchers. The nurse practitioner system is being promoted, but it's not yet fully established. There are also challenges in nursing. The quality of education can vary, and there is a lack of practical skills. Nurses often have poor working conditions and low salaries. This leads to an uneven distribution of nurses and a brain drain, where many nurses leave the country for better opportunities. And I would like to show you a short movie to share some highlights of the conference. This is a venue. And here is a registration area. You are welcomed. And this is a welcome remarks. This is a welcome speech, Bantane, or participant. On day-wise, session 1 is discussed nursing innovation. This is by Kobayashi Sato. And session 2 is leaderships. And this is a ceremony. And lunchtime, I enjoyed Indian food. And session 3, evolving practice, I presented about NP work in Japan. And session 4, multi-phased approaches. And day 2. Session 5, education and innovation. There are a lot of e-poster and an award ceremony and break time. I enjoy eating samosa. And section 6, comprehensive care practice. And lunchtime again. I enjoy Indian food again. And last session is a global nursing presenter from Tanzania. Workshops were also held. And lastly, the closing remarks. After the conference, I enjoyed exchanging ideas with everyone. Thank you for sharing. This slide shows what I observed as a current distribution based on my conference experience, nurse leadership, and role expansion. The conference emphasizes that leadership is very important. Doctors also recognized the value of nurses' leadership. The role of nurses is expanding from direct patient care to education and team management. This conference with lectures from many different professions was very meaningful to improve these roles. I also learned about nursing practice in different countries. By knowing the history and system of each country, we can reflect on our own nursing and learn from each other's good practice. And digitalization and efficiency. In India, telemedicine is used outside hospitals. Inside hospitals, monitoring systems and protocols are being improved. These efforts support digitalization and make the clinical field more efficient. In this conference, many presentations were conceptual and gave strong messages, but I felt that more clear outcomes should also be shown in the future. Discussion was active, but because there was a little time for questions, a more open exchange is needed. There are challenges in law and education, and feel like practice is done in some places, but it's sometimes illegal with low salary and no career system. At the same time, many countries focus on higher nursing education, but it's mostly academic. A more practical NP system is now attracting attention, and it may develop in many countries. Finally, here are my personal challenges for the future. I need to improve my English skills for better discussions. I also want to show the result of my work in practice to continue learning. I need to have continued exchanges with others. Thank you for listening. Thank you.
Thank you. Thank you, my Okubo. Very nice presentation. And for the next, we will invite Miss Dorcas. Yes, Miss Dorcas, please.
Thank you. Yes, got it. So, yeah. Hello, everyone. Good evening. I'm Dorcas Magawa. I'm going to take you through neurosurgical nursing in Tanzania.
Can you full screen?
On introduction, neurosurgical operative skills have developed rapidly, but initially patients were
Dorcas, can you put into presentation slide, please?
Okay.
Thank you.
Thank you.
On introduction, neurosurgical operative skills in our country has developed rapidly, but patients were being cared by nurses who has no training in neurosurgical conditions. And actually this shown a very big gap between the neurosurgeons and nurses, which was leading to inconsistent of care and poor patient outcome. And this indicated a great need for nurses to be trained in neuroscience nursing to improve outcome, safe and consistent of care. In our institute, we started with the training of trainers. And this started in 2021 with 5 nurses who were trained, partnered with the American Association of Neuroscience Nursing. And these nurses were neuroscience nursing, which is the nickname symbolized by PNNT. PNNT also, after attending the sessions from the American Association of Neuroscience Nursing, they took a diploma course on fundamentals of neurotrauma care in 2023. At the same year, they also learned about the clinical research. And also some of our fellow went to Fujita to just have exposure on taking care of neurosurgical nursing, which is sponsored by Professor Yokokato. And actually, after doing all this, there was improvement in knowledge and patient care at Moi and also in Tanzania and beyond. And also these trained nurses, they become trainers, disseminating neuroscience nursing knowledge and skills in improving patient care and outcome. We have a neuro-intensive care unit at Moi, which has a capacity of 19 beds, and mostly it admits neurosurgical patients and a few of trauma patients. The ICU has mechanical ventilator, infusion pump, defibrillator, and also papillometer for monitoring of increased intracranial pressure. And also we have a central unit, and also we have the oxygen and also vacuum system. And also our ICU beds has 5 functions. We have a pharmacy unit and a nearby laboratory unit. In terms of staffing, we have 37 registered nurses. 9 among them are critical care and neurotrauma nurse specialists. And most of the nurses are trained on how to take care patient with a neurosurgical condition in short courses, which we always perform them at our institute. And also in terms of doctors, we have 4 neurointensivists and anathologist residents, and we have 2 medical doctors and anesthesia department. We have got some program achievement. We have collaborations. We normally collaborate with the Tanzania Neurosurgical Society. They are giving a very good hand of support, and also Tanzania Nurses and Midwifery Council. And also we are members of the Asian Congress of Neurosurgical Nursing. And also PNNT has facilitated the ongoing training and exchange of experience for nurses in the country and also outside of the country. We are also collaborating with the Well Cornell Medicine and Neurosurgical Hospital. We are also collaborating with the nurses from Colorado University in the USA, whereby they are doing capacity building to our nurses. Within Africa, we are also linking with the Sierra Leone nurses, Malawi, Uganda, and also Kenya in facilitating a joint support for developing of neuroscience nursing in their countries. Also, as the team is also doing international collaboration, as you can see on the top page. One among our fellows was attending a physical conference in Egypt. And the lower picture, one among our fellows was participating in the Asian Congress of Neurosurgical Nursing as an indicator of international collaboration. In terms of training, neurosurgical nursing in Tanzania, we are conducting neurosurgical nursing training since 2022 to date. We are also participating in International Neuro-Oncology Conference. We have a parallel nursing session in every year, and also Global Neurosurgery course. We have also a parallel nursing session. In this parallel nursing session, we also invite nurses from all over the world to come and support in the training. And also we have different sessions training our nurses at MOI. And also we do train in various regional hospitals and referral zonal hospitals in our country to make sure that nurses are well equipped in knowledge and skills in neurosurgical care. And since we started this program, we have trained a total of 689 nurses and healthcare providers in different locations. We are also participating, as I've said, in local presentations, as you can see in the pictures. And also these conferences, we normally invite other nurses. As you can see, we have Matoni is also supporting us so much, and also other nurses from the world. In our sessions, we normally also encourage bedside teaching in every session. We normally go to bedside and also show them on how it's supposed to be to facilitate a good learning. Also, we have some challenges in our training in Tanzania. Actually, neurosurgical nursing is a new discipline. We don't have a college which provides this kind of knowledge. So we started creating awareness on the importance of existence of the course or mini training, so that people should understand, because we also have a very big number of non-communicable diseases, which indicates that we need so much of training on how to take care of these patients. And also there was a very big gap between neurosurgeons and nurses in terms of knowledge and skills. They do big surgeries, but if it comes to nursing care, we saw a very big gap because nurses were not aware on what to do to those patients. And also, we have, as I've said, we have no formal neuroscience nursing training in our country, even in the nearby countries. In terms of training, we see it was important to have a formal neuroscience nursing education, because we had these short courses, which is going on. It's a going on process. We are still training, but we decided to think of formal neuroscience nursing education. And currently, we developed the first draft of the advanced diploma neuroscience nursing in our institution, because we want to be the center of excellence in neurosurgical care. I would like to acknowledge Professor Yokokato for his tremendous support to neurosurgical nursing training in Tanzania. We really appreciate. And also, I would like to thank Matroni for her tireless effort. She's really doing a very good job. Even if she comes for training, she also mobilizes us and advises in so many issues in advancing neurosurgical care in our country. I would also like to thank the hospital administration for supporting the PNT program, and the doctors, the Tanzania Neurosurgical Society, for supporting the PNT program. Thank you so much.
Thank you very much, Ms. Dorcas, for that insightful presentation. Next, we will hear a brief report from Vietnam. Please welcome Manny, who will present on the Vietnam Neurological Nursing Congress from Keow Central Hospital. Please, ma'am. Thank you.
Share my screen. Can you see my screen?
Yes, but not full screen.
Not full screen.
Yes, done. Okay.
You're able to see now?
Yes,
So
ma'am.
for the next 10 minutes, I'm going to share with you just a brief report on the 9th Vietnam Neurosurgical Conference for Young Doctors and the Vietnam Neurological Nursing Congress 2025 in Hue City on the 20th to 21st June this year. So this is the flyer, the program. We have actually there were a lot of good papers that the nurses presented. There are so many talents there. The nursing programs involve lectures and free paper presentations. Total, there are 7 international faculties and 16 national faculties. Total participants of 200 nurses from all over Vietnam. So these are the international faculty. And I have the privilege to introduce about ACNN. After the briefing of ACNN, 31 neuro nurses from Vietnam joined ACNN as membership. So this is the national faculty. Actually, they have a lot of talent. The nurses are very good, but only thing lacking of communication skill. And say the room is fully occupied. 200 nurses from all over Vietnam joined the conference. And Q&A session, even though don't have ample time, but then there are some questions raised by the participants. So area for improvement, maybe it should, a bigger hall will be benefit for the nursing session, and if possible to encourage local speakers to present in English, even though there are some Miss Hart has helped to translate the Vietnamese paper into English. Maybe I think there will be some differences in terms of translation. It is good that if the nurses can present in English. Maybe in the future events, we should consider hands-on workshop, which is very important. Both theory lectures and clinical is both very important for neuro nurses. And on behalf of ACNN, I'd like to express my deepest appreciation to Professor He, Prof. and the organizing committee members for such a fruitful congress. Professor Yoko Kato, we extend our heartfelt gratitude for your unwavering support and your generous donation, so that is why 200 nurses able to attend this congress with your donation. And to all faculty, thank you for your support and participation in making the event a great success. And thank you for attending the event and contribution to its success to all participants. I think that's it. A very brief report. Thank you very much.
Thank you very much, Mary, for your report. Now, I would like to invite again our commentator, Professor Yigu and Ms. Pam Tingok, to share their comment and suggestions. Please, Prof. Gu and Ma'am Pam Tingok.
Okay, thank you, Christine. And thank you to Ms. Mai and Ms. Dorcas and Meijin Yi for your sharing and for your excellent presentation. And from the presentation of the Mai, we can see the ACNN held in India, and Meijin Yi introduction of the nursing conference in Keow, Vietnam, and you can see these are very successful conference with the tremendous and the continuous support from the Professor Kato and the efforts of the Meijin Yi. And from the introduction, we can see they also all mentioned the uneven nurse distribution and education. So I think this is a common phenomenon in China also, because the development of healthcare in China is extremely unbalanced, just like the different countries. Like in Beijing, the capital of China. I don't know the exact number, but only in Beijing city, there are more than 70 big hospitals, more than 500 beds, and because there is a large population in Beijing city, is more than 25 million populations in Beijing city. So this is the developed areas like Beijing, Shanghai, and the southeast coast of China. This place have plenty of medical facilities and the staffs, the doctors and the nurses. And while the Western China has limited resources. So this is unbalanced distribution and developed situation. So I think we need held more conference and especially hands-on course in the future to develop the skills of the nurses. And but the difficult thing is the limited funding, and in the same time, the Meijin Yi in Keow City my department held a conference. Nursing conference is one of the parts of the conference. We invited the matron E, but the time conflict, and the raise funding is very difficult. So we have to control the number of attendees. So this is a big problem. I thought in each countries is the same thing. So we need to find more fundings from every source for our future education. That's all. Thank you.
Thank you, Professor Gu. Any comment from Ms. Pam, please?
Yes, I also agree with Professor Gu that funding is one of the big problem for like not only for the doctor but also for nursing conference, because if normally the nurse, as I mentioned, we only have one hall for the nurses, but we have long session and a lot of presentation. So that is the problem of the funding. If we can raise more funding, so we have more hall, so the session will be more longer and we have more time for presentation and discussion. And I also agree with Miss Chang, Miss Yi. She mentioned about maybe one of the solution for the nursing conference, if we can encourage the national faculty to present in English, that will like fix the language barrier. But in the case that if because the Hui it is in the center of Vietnam, so maybe not much of the nurses they can speak English. But if the in Hanoi or maybe in the Ho Chi Minh City is a bigger city, so maybe the nurse they can speak English more. But in the case that the nurse they cannot speak English, maybe we can like have translate or by translate from English to Vietnamese and Vietnamese to English. That is also one of the way to like fix the language barrier. And I just think just one more thing suggestion. I think that maybe because we have this website for the uh, neuro community, right? We also have for the doctor, but I think maybe if we have like website for the neuro nurse, maybe we can like publish some like the case study if we think so. In the case study, we will show that how we take care for this kind of patient, so we can learn to each other, and it can like exchange the knowledge and the skill. So that's it, just my thinking that maybe we should have like the website for the neuro nurses, so and we can update like the information. And one of the problem from like the nurse in Tanzania also mentioned about if we have more like the um, training program like exchange, we can come to another country to learn more. And for example, if Vietnamese nurses, we can come to China, we can come to Malaysia or Japan to participate in some like the short-term course, so we can learn more about like how to take care of the patient, and we can back to our country to sharing for our nurses. That is one of the good way for like update the knowledge and experience. That is my comments. Thank you.
Thank you, Ms. Pam. Any comment or suggestion from Professor Aniaku, please? Please, Prof.
Yeah, thank you so much. Next Christian. Yeah, as I said earlier, it's very, very interesting seeing what is happening in the world of neuro nursing. This importantly, in meetings where you are having a global meeting of specialists, language is central. But it's important to communicate in a language we understand. So it's important to fix this challenge of language so that we can all relate and relate effectively. So as I said earlier, I will take the message of this meeting to my people. Neurosurgery, as it is evolving in Africa and then in Nigeria particularly. So we concentrate in training the neurosurgeons, but the care of a neuro patient is not complete if we don't have a well-trained or well-trained neuro nurses. So I'm glad being here. Thank you so much. Thank you. Right.
Thank you, Prof. Thank you. Thank you very much for suggestion and comment, Professor Guo, Ms. Pav, and Professor Aniaku. As we come to the end of today's webinar, I will try to once again invite Professor Kato to deliver the closing remark, Prof. Please, thank you.
Thank you. Thanks so much. I think the developed countries, I see so many restriction of so many restriction of the how to say the nursing care. But I think developing countries still they can do more. I think. Once I visited long before I visited Vietnam, many of the nurses so work hard. Well, just one nurse, maybe they're just like a nurse practitioner in Japan. Same work, just one nurse taking care of immediately after surgery. Most of them is the intubated patients, the 10, 15 patients at one room. Just one nurse can taking care till the morning, I think. So the country by country is very different nursing rate, but I think you can communicate and collaborate more. And anytime that you can visit us, even in 10 days or 2 weeks, then we can see us. Then we can exchange our knowledge. Maybe we can support once you decided to come. Thank you very much. Very nice work, actually. Thank you so much.
Can I add something?
Yes, please.
Actually, we have few centers that offering fellowship training for neuro nurses. But the problem is funding for these nurses. They have to come up with either the institution have to come up with their travel fare, their expenses. And some centers, they don't provide free accommodation. This is the limitation for neuro nurses. So Professor Yoko Kato, Fujita University Hospital, welcome all the neuro nurses, but not many. Until today, only few went over because of funding. And even Professor Yigoi also is willing to accept neuro nurses for fellowship. But so far, after me, Ms. Hart, and Ms. Lam came back, none went because of funding again, because neuro nurses have very limited funding. I'm not sure how we should help these nurses. Training is very, very important for the nurses. And regarding the website, we have under ACNS, under nursing session, we have come up with e-text. So nurses can go into ACNS website under nursing, e-text already published in neuro nursing. And there are some publications also, and some newsletter. Maybe some of you can read up. I welcome nurses who with research paper to publish in the website. So I'm still waiting. Not many right now. Only few newsletter published in the website at this moment. So I think funding is a major problem for neuro nurses all over, especially for low-income countries. Yeah, Professor Yoko Kato, not sure how to help them. I wanted to help them. I always go and with my own fund to help them, to train them, but I cannot be helping every country. I'm not sure how I can help them. That's you have to train your own nurses. I think that is the most important part is keep training, and keep training your nurses. And they will be, one day they will improve. They will be in par with the other countries, your nurses. And I want to congratulate Lucas. You all have come up with advanced diploma program. I have gone through, and I even liaised with Sister Syria. I think you all are proposing the program, right? The curriculum. When are you going to start the program?
Yes,
You're
Matroni,
muted.
we have
Yeah,
already.
Sister.
Hello, everyone. Thank you for such a wonderful webinar today and very good discussion. We have disseminated our curriculum to the nursing authority for review and advice on how to go through about that. We are still waiting the feedback from the nursing authority.
Thank you, Sister. I hope it will be implemented very soon so that you were able to train more nurses.
For sure. Thank you.
I think if there is no other comments or suggestion, we shall end here. Thank you very much, everybody, for joining. And I hope we will continue to collaborate, and neuro nurses need to move forward, must move forward. Even though with limited resources, we have to move forward. Okay, thank you, everybody. We'll see you again next webinar. Thanks.
Yeah.
Thanks, Prof. Raja. Thank you.
Thank you.
Bye-bye.
Bye-bye.